There are a variety of reasons that can limit someone's access to health care. And even though lawmakers and most people believe having a developmental disability shouldn't be an issue in that regard, many find it can often be one. In our Health Alert tonight, KEZI 9 News anchor Jennifer Singh brings us a closer look at this issue and how it's affected at least one family. Jen?
Yeah, Matt, this is a big deal for healthcare in Oregon. Let's start by meeting the Tennysons.
He's amazing. He can go forwards and backwards through leap years, doesn't matter. What day was July 4th, 1776?
Thursday.
Calendar head.
That's Alex Tennyson and his father, Larry. Alex was diagnosed with autism at the age of 3 and lives on his own just a couple blocks from his dad in Milwaukee. But lately, about every month, something goes wrong.
What are you hearing in your head?
I'm hearing Percy's whistle.
Yeah. He hears train whistles from when he was a kid. What do you think? What do you think when that happens?
That makes me scared.
Yeah. How'd you get that knot up there?
Because.
You hit your head to try and make it stop?
Yes.
A recent episode lasted overnight, so Larry took Alex to the emergency room, hoping for a mental health hold and a psychiatric evaluation. A doctor told him that because Alex has a developmental disability, he doesn't make a good patient for mental health services.
I said, what difference does it make if somebody has DD? If they're having a mental crisis, they need treatment. It shouldn't matter. What's the deal?
The lesson they learned is that people with intellectual and developmental disabilities facing mental health care in Oregon can quickly get left behind. The medical system can isolate one area from another and classify symptoms as behavior. State Senator Sarah Gelser-Bluen has seen this problem firsthand, so she knows just how harmful it can be.
It's not appropriate for a person having a psychotic break to walk into an emergency room and be told, we don't do people with intellectual and developmental disabilities. I was told, as a person that's worked on this for years and a legislator, that there are 3 systems: a medical system, a mental health system, and a DD system. And my family member belonged in the DD system. Individuals with intellectual and developmental disabilities need to access all 3 systems because they all provide different things. And the fact that we don't do that in Oregon is nothing short of discrimination.
And she's not the only Oregon lawmaker who recognizes the issue. This year, they passed Senate Bill 1557. The Oregon Health Authority then sent a memo to hospitals and mental health organizations, making it clear that providers can't deny access to mental health assessment or treatment because they have an intellectual or developmental disability. The memo says providers should assess clinician competence and confidence in this area, ensuring they're prepared for the intersection between mental health and disabilities.
When providers say, or a CCO says, but we don't have anybody that's trained to do that. Okay, what are you doing to get people that are trained to do that?
A similar proposal for adults over 21 was folded into a bill to change civil commitment standards in Oregon. That bill died in committee. As for the Tennysons, Alex has some rescue medication he can take. He calls it a chill pill. But in moments of crisis, he doesn't think to take the meds on his own. Both him and his dad just want access to treatment. Live in the studio tonight, Jennifer Singh, KEZI 9 News.
All right.